Hi, I'm Dr. Chad Larson. This week's articles address the importance of proper blood flow. The flow of our blood through our circulatory system uh, has effects on every end organ, like the liver, the gastrointestinal system, the kidneys, the brain. So it's very important for us to have proper blood flow. There's lots of different factors that affect our blood flow, but in this week's articles we addressed a couple different things. One is that the viscosity of the blood, the thickness or thinness of the blood, really has a lot of effects. When the blood viscosity starts to increase and it gets very thick and sluggish, it puts us at a risk for developing blood clots and for developing other blockages in the cardiovascular system. So there's a lot of different ways to address viscosity of the blood. Things like fish oils can help to lower the viscosity of the blood and allow the blood to flow easier through the blood vessels. When it gets severe enough, we recommend, or especially if somebody has a history of making blood clots or of strokes caused by blood clots or deep vein thromboses down in the legs, those kind of blood clots, or somebody just has a genetic predisposition for developing blood clots, we recommend a more specific product called cardiokinase. Cardiokinase is the most current form of nattokinase. Nattokinase has been around for a very long time, developed by a Japanese researcher named Dr. Sumi, and cardiokinase is his latest and most effective form of nattokinase. And it's been used for various conditions, but most of the studies have looked at deep vein thrombosis in the legs, and it shows some really impressive effectiveness for helping to dissolve the blood clots and also help to decrease future blood clots by dissolving a component in the blood that contributes to the thickness, which is called fibrin. And if fibrin gets too built up, then we're at a greater risk for developing blood clots. So that's one issue with blood flow. The other one is cholesterol. So many people think cholesterol is the bad guy, and that cholesterol needs to be brought down to ridiculously low levels because it's thought that it's cholesterol that clogs up the arteries. Well, that's not really true. The fact is that cholesterol is not really the problem. It's when cholesterol gets oxidized. When it gets oxidized, it creates a whole different molecule, and oxidized cholesterol is very bad. Oxidized cholesterol has been linked with heart attacks, with heart disease like atherosclerosis, and it's been shown to contribute to blocking of the arteries. So what's the difference between those things? Regular, non-oxidized cholesterol is totally healthy and normal, and the human body is totally healthy with cholesterol above 200 if it's not oxidized. But it's when it becomes oxidized that's an issue. And there's various things that can cause the cholesterol to be oxidized. And most of it, comes down to diet, really. If the diet is improper and there's a lot of foods that are, refined grains and sugars and bad fats, you're going to get oxidized cholesterol. So those people that aren't, willing to make changes to their diet, they probably just have to be on statins the rest of their life to keep the cholesterol down, because the idea with statin drugs and other cholesterol-lowering agents is that, the lower the cholesterol is, the lower the chance that it's going to get oxidized. But, in natural medicine, we don't necessarily try and, chase the cholesterol around and try and drive it down, even with natural therapies. That's not really the key so much. The key is to prevent the cholesterol from getting oxidized. So how do we do that? Really the main thing is antioxidants. When there's oxidation happening in the body, especially to the LDL cholesterol, we want antioxidants to help prevent that from happening. So we're back to diet. We're back to the thing that gives our fruits, berries, and vegetables their colors are antioxidants. The blues, the greens, the purples, the oranges, all those things are antioxidants. So that needs to be the centerpiece to the diet, is making sure that you're getting an abundance of these fruits, vegetables, and berries on a daily basis to help prevent oxidative damage to the LDL cholesterol, because that's the bad guy. And also, if the diet at certain times is a little deficient in these antioxidants, then you could take a superfood, high antioxidant product like New Greens or New Greens Berry.